we are live. Welcome, everyone, to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts for the Melanin Initiative podcast. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down to language you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking up too much of your time. All month long, we've been talking about breast cancer. Each of our guests have been sharing their relationship with breast cancer. And so it's a little bit different than our typical shows, but because of your feedback, we know you've been getting a lot of value out of them. We're so grateful to all of our guests and for all of your outpouring support. We have a few more episodes left. Some might spill into November, but we think you'll be okay with that. So often people think they're the only ones going through something, and that leads to suffering in silence. We know and hope through this show, you'll see that you are not alone and that there are a number of resources available to help you. We hope you'll be motivated to do what you can when it comes to your health, to establish a relationship with your primary care provider who can identify your risk factors and talk to you about all the available options. More importantly, we hope you'll understand the importance of early detection, which I cannot emphasize enough. Knowledge is power, and so is having a support system and understanding the importance of advocacy. In their absence, my co-hosts, Geraldine and Alicia, send their love. They'll be back in just a couple weeks when season 2 officially kicks off. I'm joined today by Dawn Muci, who will discuss her relationship with breast cancer from start till today. As a reminder, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone you know is having a mental health emergency, you can call 988. Today, Dawn Muci will discuss her relationship. So let's get started. Welcome. Thank you so much for spending some of your time with us.
Thank you.
Before we get in, good. Yeah. Have you been on a podcast before?
An actual podcast? No.
Oh, well, wonderful. Well, I hope that this is a positive experience and that this won't be your last time.
Oh.
So before we get into the questions and your relationship with breast cancer, kind of just tell us a little bit about yourself, where you're from, what's your structure, your family structure is like, and what you do when you're not filming podcasts.
So my name is Dr. Dawn Muci. I'm a physical therapist, so doctor of physical therapy. It's the same as like doctor of dentistry or doctor of pharmacy. It's that terminal degree. I've been a physical therapist for over 20 years, so we don't need to talk about how long that's been. Currently, I'm in Saint Petersburg, Florida. I work at a local university. I have a history of, everybody wants to know this. I worked for Cirque du Soleil for almost 12 years, not as a performer, shockingly. I've kind of been a little bit of a gypsy until I got married 10 years ago and settled down in Florida. We've been here longer than we've been any other place. So St. Pete's a cool place. When I'm not doing podcasts, I'm working lots of hours. Following the university sports, I tend to try to attend a few games every week. And my husband, he works as well. We did have a dog and he just passed like 2 weeks ago. So that's about it. So we're kind of in that, like, kind of taking care of ourselves phase right now.
Oh, so sorry to hear about that. That is a very hard loss. It doesn't always get the same attention as, humans, but it's tough, right? They're a member of the family.
Yeah.
So actually, I was just in St. Petersburg last weekend for a dermatology conference.
Oh, really? Where?
Around where it was downtown by the pier, actually, at the Hilton.
Yeah.
It was Sunrise Dermatology Conference.
Very cool. That's a cool area. It's changing quite a bit. You can see there's building a lot of condos. Right now, it's like kind of a little artsy area. You can kind of just like walk and get kind of the beachy vibe without all the people, but I'm worried it's changing a little bit. But yeah, I live very close to there.
Oh, yeah. And yeah, I didn't know you did physical therapy. We might have to have you back on for a different episode. I was just thinking about season 3, and I wanted to talk about a certain topic from the physical therapist perspective. So yeah, this might not be our last time having you on.
Okay.
Yeah. Yeah, that's great. That's good to hear. So let's get started. So, what is your relationship with breast cancer?
Yeah, so I'm an only child. My mother was diagnosed with breast cancer. Everybody wants to know how old she was. They always ask me. She was 51. And then actually I think she might have been older than that, but everybody always says like all the doctors want to know if she was postmenopausal. Well, she had had a hysterectomy when she was 29, so I'm not really sure. So she had breast cancer. They did a lumpectomy. They didn't get clean margins, which is weird because she had DCIS, which is like kind of level 0 or 1. Um, so she was in rural Illinois, so very small town. Nearest hospital is an hour away. There's one in the town, but it's only open like 8 to 5, doesn't have emergency. So it's very rural. It's hard for people to understand that, but those kind of towns still exist. So she went from her kind of local hospital up to Mayo Clinic in Minnesota, was told to have a radical mastectomy, had the mastectomy, ended up getting, the augmentation and all the plastic surgery after, and was pretty healthy for about 3 4 years, and then she actually started developing MS, which is kind of a whole different ballgame. They're not really sure if it was due to kind of her hormonal balance. They kind of don't know.
Mm,
They didn't put her on tamoxifen, which is everybody, the doctors always ask me that as well.
mhm,
And when she developed this MS, they just knew she had all these lesions in her head. She was quite sick, actually lost her function to walk and talk, and it was pretty fast decline. Because it was so fast, they actually thought that it was the breast cancer metastasizing. As we know, the brain is one of the big ones that it metastasized to. And since she couldn't walk. Since she had such low level function, they thought, oh, it might be in her spine. She was up at Mayo's, lots and lots of tests, lots of tests. They decided to go ahead and treat those mets that they thought were on her brain, and it ended up being MS. So it was a whole kind of, if you radiate MS, it tends to flare more. So she declined even further. Anyway, she ended up succumbing to the disease. Probably she was 61 when all this finally happened. But because of that breast cancer diagnosis, it was very, I would say, challenging at the time for her to get treatment. Um, Partly because she didn't have she had a regular doctor. We were in this rural area. The medical care is okay, but she was driving 8 hours up to Minnesota to get care up there. So, and she ended up going to Chicago at one point with Northwestern, so that was a little bit closer to home. She ended up being at Northwestern for probably like 2 years, but it's just a challenge that I think people still don't understand. I mean, this was a long time ago, as in like over 10 years ago, but these challenges
okay,
still
not
exist in
not
rural.
that long, not that long.
I
You
mean,
know?
I think these challenges still exist. She didn't have access to good healthcare on a daily basis, so it was very challenging. Her and my dad didn't know. They were trying to navigate it. Just it
Mhm.
was tough. So
Yeah, I'm
yeah,
so glad
that's my
you brought that
I
up,
don't
actually.
I don't have breast cancer. However, when I was 27, before my mom was even diagnosed, I had a lumpectomy right out of grad school. I found a lump. The doctors at the time said that we're just going to take it out. It's just better for everything. It was benign. Since then, because of that, and because of my mom's diagnosis, I don't
Mhm.
know the equation, but I'm at this high risk where they want to do imaging every 6 months.
Mm,
Because of that, I feel like we keep finding things. I
mm.
mean, I guess it's good, but this has been going on since I was literally 29 is when they diagnosed me as like this high risk per this equation. Um, and so the amount of MRIs and mammograms
Mm.
I've had, I'm now 47. So for 20 years, I've been dealing with this. So 4 years ago, my doctor put me on tamoxifen
Oh, wow.
to decrease my risk. As a prophylaxis, there's a research out there, quite a large study, um, that if premenopausal females take tamoxifen that have this risk with the family and whatever my equation shows, that it decreases my chances of developing breast cancer by 50%. Um, tamoxifen has been around for years. It's an estrogen blocker, and it's actually quite not nice to be on. I am not in menopause, I just have all of the premenopause or menopause symptoms, so it's just all the weight gain, not sleeping, hot flashes, brain fog, everything, joint aches, like, all these things. They're like, "Oh, yeah, it's the tamoxifen." So, I have 1 more year, and then hopefully I can come off of it. There, that's my story.
Okay, so
That's
let's
all I'm gonna
let's
do.
back up a little bit because this is a health literacy podcast. And so one thing we're trying to do is make sure people can follow along and that we kind of address those things we kind of run by in the clinic pretty often. So you mentioned MS, that is short for multiple sclerosis. It's a disease that can have varying levels of severity and progressiveness, but essentially it attacks your nervous system. And so everything that your nervous system controls can be affected by this. She mentioned like coordination, mobility, walking, talking, just so you can see, man, that had to be a really hard time during that diagnosis because all the symptoms you were mentioning, your first thought is just gonna be like thinking about the cancer because that's her history, right?
Yeah,
You go with the first thing. So I can only imagine, and I'm so glad you brought up access because we actually haven't really talked about that so much in this special during October, and that's a huge, huge problem in healthcare. And so we can take it for granted if you live in a place like a high metropolitan place.
city.
Actually, both of us, I'm here in the DC metro region, and then you're down there in Florida. It's easy to find a doctor. If the first doctor can't get you in, you
Right.
can find another one. In a rural setting, that is not an option. And if you
Mm-mm.
do find a doctor, the wait it could literally be like 3, 6. I've heard people waiting a whole year for an appointment, especially when you start talking about specialists,
Yeah. I
you
mean,
know?
she said getting symptomatic for probably I was living in Vegas at the time, for probably 6 months, and when she finally told me, my my recommendation was, "Well, come out here to Vegas. I
Mm,
have a whole team of doctors that I use with Cirque du Soleil, like, they'll be able to get you in," and they didn't wanna do that. They said, "No, no, we're just gonna stay. We have a Mayo's follow-up in, like, 2 months." So I think it was almost 8 to 9 months before they even got a follow-up, and so she'd been dealing with this for quite a long time. One of the symptoms that she had, was a lot of nausea, and again, they just assumed it was mets in the
mhm,
brain, and so she had lost like almost 40 pounds by this time. Like by the time I saw her, it was probably 3 months. It was right after she had gone to Mayo's. And I was like, what is happening? Like she had deteriorated so quickly. So
mm, yeah. And then, like, so you say you wait 8 months for that first appointment or even a follow-up, but, like, my
yeah,
mom was on last week, and actually she brought up tamoxifen, and we talked about how often she would have to go for chemo and radiation. So for chemo, it's, like, every 21 days, and radiation was literally 5 days a week, and
yeah,
I've taken care of people who their whole family might have to travel with them. Some of them cannot afford to all stay in a hotel for the length of
yeah,
time someone might need care. So some hospitals have deals with local hotels, like, especially if it's like a teaching hospital and there's a campus
yeah,
on they can walk, right? That's very convenient. But I have been at hospitals where they don't do any of that. They say you can stay while they get admitted and you have to leave. And these
yeah,
people are together every day, all the time. That's the person who makes all the money. They're in the hospital and you're telling me I have to go sleep in my car
yeah.
at night? That's real life. Like, people were literally they're like, "Well, I'll just," and we couldn't let them in during especially during COVID, couldn't let people stay in the waiting room. I mean, it's a real part of healthcare. And so sometimes people get labeled as, they're not following the treatment plan or they don't care about their health.
They
And
can't.
that
Logistics. Yeah.
this has nothing to do with that. And even telehealth is not always an option if broadband is not adequate.
Yeah, that's true.
Mhm.
Yeah, I mean, this was before there was much telehealth. So
Mhm.
I actually, when COVID kind of hit, I actually wondered all that. Like, I wonder how her trajectory might have been a little bit different because for sure it was, I mean, I don't know how much they actually would tell me, but I mean, it was like 8 months of her deteriorating. Like,
Mhm.
nobody would wait that long if you had access to a doctor right there. And
Yeah.
these are both of them are intelligent people. Both of them went to college and had masters with my parents, but I think dealing with such rapid deterioration after you've already had that cancer diagnosis, I think there is a little bit of a psychological, like, do you really want to find out or do you just want to kind of live it out a little bit? So,
Oh, you're bringing up so many good points because my mom mentioned that because once her like her bone issues started kind of progressing, she was like, "Yeah, I just kind of didn't want to know." I
Right,
kind of stopped asking some questions because you had already been through so much, and yeah, that
right.
psychological impact.
Yeah,
And
I
you
mean,
you brought up their education because people can. It's not. No one's immune. You can be
yeah,
super smart, but you still become impatient.
yeah, I mean, I don't know, it's hard because, I am in the medical side and as soon as I was back home in my small town, Illinois, which also was not super easy to get to, I have to like fly into Chicago from Vegas, drive 3 hours, rent a car, it's just not easy to get to. Um, when I saw that, I was like, "What is happening? How come we haven't like followed up on this?" And my father's initial response was like, "Why are you here telling me what to do?" Because I'm still the daughter. I'm working for world class athletes at Cirque du Soleil, and they're like, "Yeah, I'm not listening to you." Kind of that attitude. Like you haven't even a little bit like you haven't been here for all the stuff. Obviously I went to Mayo's when she had her mastectomy. I was there for the week. But like, I'm not there on the day to day. And so I think he was just like, we've been managing. Like, why are you coming in to like tell me what to do? And so it was for sure a challenging time. I also like just my job was working 6 days a week. So it's hard to travel. I mean, I was literally taking kind of a red eye. It's not really a red eye, but like a late flight on a Sunday night. I'd be at home for Monday and turn around and fly back Monday night to be at work for Tuesday. So it was quite a challenging time. I don't know that me being around would have changed the outcome. Like I think they were still kind of set on their direction, kind of not really wanting to find out.
Mm.
Definitely.
Yeah, someone, our because also my mom had breast cancer, so so much of our stories parallel because once you are in healthcare, there's a lot of information that you're exposed to, right? So you have your own anxieties, you have your own fears that you go through, and walking that fine line of how much do I tell them, right?
Right.
Before we have actual information, but having
Right.
enough information, we're like, well, maybe you should do these other things though, and it's such a fine line. And then I do struggle with my parents sometimes where it's like, you sent me to get all this education, but when I give you the information,
You
you
don't
don't
want to hear
want
it.
yeah,
Yeah.
it's it's very frustrating.
I was in an appointment up at Mayo's with her oncologist, and she ended up being seen by a neuro oncologist at the end, because she was having all these neurological, and I mean, they still think that the cancer probably kicked off this MS because who really develops MS at 50 plus years? She'd never had symptoms before. And so I'm in the appointment with her and my dad, and the doctor says, "Oh, I understand you're a physical therapist." And then he did like the worst thing ever. He started just talking to me in medical terms, and like, of course, both my parents, being smart, still didn't understand all the lingo. And, he was just throwing down everything, just talking to me as if I were one of his PTs on staff. And so it was quite frustrating. I remember being in that appointment and like getting really uncomfortable and saying, would you mind kind of going back over the stuff so they can understand? Like, I understand the language. And he goes, "Well, it's just faster for me to talk to you." And he's like, "I'll have my assistant come in." And I just remember, like, okay, we're at Mayo's, we're at this big hospital. I get it. You're busy. But at the same time, like, it's still my parents? So it was difficult, but it is what it is. And I understand that. I think I always try not to do that with my patients. So I think that because what a horrible feeling, like the doctor didn't even care enough to like relay the info in like layman's terms. So yeah.
Yeah, I'm so sorry to hear that happen, but yeah, it's just a weird dichotomy, right? Because you understand he's got other patients, and yeah, there's someone
Yeah.
here. You can also send someone in here who can make that connection. But at the end of the day, it's really every person on that team supposed to build that rapport with
Right.
the patient.
Right.
Yeah.
Right.
So yeah, you've shared so many of like your experience navigating the healthcare system and your where how's your dad?
I don't know where my dad is.
Oh.
um, you know, after my mom passed, I think like he really struggled with some mental health. I don't really know. Just the conversations we had were really kind of nonsensical would be an understatement. I understand he's still around. I talked to his brother, my uncle and aunt, so I know he's still around. I just don't know. He's not in Illinois anymore.
Mm.
Um, I heard he's just kind of traveling in his trailer. Yeah, he's in his 80s now, but I never really hear from him. It's been like over 10 years. So he kind of,
Yeah.
I don't know, my aunt and uncle, they also don't really keep in touch with him. So I think like kind of, yeah, grief is real. And I don't know. He retired. They had a business, him and my mom, and he sold the business. And that's kind of, nobody's heard from him since.
Wow. And yeah, that sharing his story is so important to this topic because the person, if the patient goes on and unfortunately they do die due to cancer, they
Yeah.
leave other people, right? And we don't actually never know what happens to those people. We never really talk about them, and especially the mental health aspect of that. Especially if they had been how long had they been married?
I mean, I was 30 some years
Yeah.
old when she passed, so 30 plus, let's say
Yeah.
35.
Your whole adult life, right? And now
Yeah,
they're gone.
yeah,
It wasn't the homegoing that you thought it was gonna be, and you're getting
no,
older, it's tough, right? They don't get enough light shed on that, and it's hard to
yeah,
ask for sometimes,
yeah,
yeah. Yeah,
yeah,
and
and
so
I
now
think I
oh, go
think
ahead.
just, like, them being in kind of this rural area, everybody knew my mom and dad as, like, this couple,
Mhm.
right? Like, it's a small town. Everybody knew everything that was going on. So I guess, I mean, I don't know, but, like, I have friends that still live in the same town that I grew up with. They never see him, like, so
Mm,
I think it was too painful, so I don't know where he
yeah.
is.
Oh, well, we appreciate you sharing that story. That's
Yeah,
not I'm sure
it's
it's a
kind of
topic you
not
talk about all the time.
yeah, it's kind of not a happy ending for that part.
Yeah. And so the reason you're even a guest here is because my mom, told me about you. And so how did you 2 meet? What is it you have in common with each
Yeah,
other?
so we're both advocacy ambassadors for the Susan G. Komen. So it's kind of a strange story. We probably wouldn't have really like crossed paths. So in March, we were both asked to come and do like a little mini lobby in DC. Um, and Miss Leona was like assigned. So I had a partner and she had to leave early, and we were doing all the Florida, and she was doing like all the DMV kind of talks. And at the end, they didn't want to just send me by myself. So they said, "Oh, the ladies from Virginia will come. They're so great." And of course, these two powerhouses, like they were so polished and so smooth. And so, like, okay, I won't use any like official politician's name, but we were in a Florida one, Republican. The gentleman has kind of made his mark in Congress for fighting Obama with Obamacare. He was like the leader for he didn't want Obamacare to go through, which I don't know. I have my own opinions, but without getting political, I don't understand why a country of this magnitude and wealth cannot supply healthcare to everyone. But that's just me. Um, and we're at this meeting, and the two ladies from Virginia are going on and on about how there needs to be diagnostic imaging and everybody needs access to this. And basically, if you cover it before it becomes actual cancer, or you get it right away, it's going to decrease costs in the long run. And literally the staffer was just like, nah, I'm not interested, like kind of blew him off. And it was so difficult to like, I was sitting on the side, and I'm facing the ladies, and these two ladies from Virginia, they got all their talking points down, and like just you can hardly argue with this. And the staffer was just like, no, we don't see it that way. And just kind of blew us off. But yeah, so the ladies from Virginia, they definitely know their stuff. And then we did another advocacy summit this summer, which was a much bigger scale. And so I'd run into her there again. And it's actually the other girl from Florida I'd seen as well. So it's kind of our little troop that we kind of coordinate and see each other now. It's kind of nice.
Yeah, and actually, I love that you're on here and you're representing another face to advocacy because so far, well, I had my mom and I had Lori Lee on, another daughter,
Mhm.
and so sometimes people don't realize like you can have any relationship with a disorder and still be involved in the efforts to make things better.
Yeah, so I actually wish I would have known about the Susan G. Komen a little bit more when my mom was going through all of this. I knew about Susan G. Komen because, she had the radical mastectomy, and the plastics doctor, had said, "Oh, because you're older, do you want your other breast to match?" And I was sitting in this appointment like, "What? Why would what is he talking about?" And he said, "Oh, Susan G. Komen passed legislature years ago that insurance has to cover if you need cosmetic on the other side. So basically, you don't get like a 19-year-old breast that looks very nice and young to go with like your regular breast." And so he was saying, if you want me to lift it, if you want me to like make them a matching pair, like Susan G. Komen has passed this insurance, that insurance has to pay for this. And so my mom, of course, was like super excited for that. But um, the advocacy program I'd heard about through a friend who actually used to work for Susan G. Komen, the 3-day walk. And she was my college roommate. And she worked for Susan G. Komen on the event side for many, many years. And she had asked me when I was living in California if I would come do medical care, like the sports medicine coverage in San Diego for the 3-day. And so I went down and did that. What an experience, by the way. If you ever get a chance to do a 3-day, I would love to do it.
Mm.
Um, and then she had told me when I was down there that, like, oh, you would be really good as like an advocacy speaker because you have your medical background, you can talk the talk, you can like relay the info, you should probably apply. And so she sent me the info. So that's how I got into it many years later, actually. My mom had been gone probably like 5 or 6 years at that time when I did the 3-day. So yeah, kind of a roundabout way.
And so it sounds like kind of what you actually do as an advocate for Susan G. Komen is you go to meetings, right? A few times a year.
Yeah,
Anything else you
so
do?
the advocacy, so the it's under the public health department, the public health side or like legislature side where they're really working to try and get funding and keep breast cancer, and now it's kind of morphed into a little bit more of women's health and initiatives as well. Keeping that in the forefront, so when your government or your representatives for your state area um, kind of keep that in mind and really associate like, oh, I heard these stories, this is really moving, this is really important, I would like to vote for more funding, is basically because there are quite a few programs out there. I think over the last few years, a lot of those programs have undergone a lot more scrutiny and haven't gotten as much funding. And so I think the pandemic kind of shed a lot of light on the shortfalls, let's say. And so I think me being furloughed during the pandemic and sitting at home and watching the news every day and going down the CNN hole kind of proved to me that I couldn't just sit there on the couch anymore. I needed to go do something. So it kind of went hand in hand with what when my friend had like recommended. So yeah, it's
Hmm.
really, I think it's important work. Um, a lot of other programs have advocacy ambassadors as well, I think, but I can't think of anything more important than like women's health initiatives. So I think that's like nobody's really spoken out for that for the past couple 25 years. So
Yeah, thank you so much. We thank you so much for coming on. Before I do my closeout, is there anything else you want the audience to know about breast cancer, early detection, rural health, speaking to patients, or advocacy? You can pick any of those if you like.
I think that advocacy would be really important. I think, um, I was a little bit actually intimidated to kind of join this group. Like, I don't have cancer, and there's so many cancer survivors, and my relationship with cancer is quite old now. Like, it's been over 10 years that she's passed. So I don't have, like, I'm not going through the struggle, but I think I can still be a voice for those that don't have a voice or can't go be the voice because they are going through treatment. And I think um, as a voter, the elected official, their job is actually to listen to what the voters want. And so I think that also has been lost over the last couple of years. Like, we just elect these people or these people are elected and then they just do their job. And that's not really how any of it was set up. I mean, you're in the DMV. So I think, using your voice, and Susan G. Komen has a really great, really, really organized platform. Like they have classes online that you go through. There's lectures, there's talks, and then I mean, just meeting all these wonderful women. There's also men too, but all these women that have these crazy stories and have come out on the other side is really quite powerful to go through and think like, okay, like I'm kind of not alone in this and I'm kind of doing something for the next generation. So I think it's really important work.
It is. Thank you so much. You hit on so many high points, and I'm so glad we were able to hear about the experience of being an advocate from you with your background. And actually, you say because you're a little bit distant from that event, I think you probably are in the perfect time because I think people who are really close to it don't feel comfortable. They don't have the emotional courage yet to come on a
Yeah.
platform like this and actually speak about it. So you might be in your prime to do that because it's
Yeah.
still, enough where you can remember it to the degree that you want to remember, but also be okay with speaking about it and not be afraid that maybe, you might break down or that your story won't have
Yeah.
an impact,
I
or that
mean,
no one
I
wants to
feel like,
hear from you. People think that too, like, oh, no
yeah.
one wants to hear from me. They've got all these other, so like you just said, these women who've gone crazy. So, well, her story was crazy. So they don't want to hear from my simple story. We can do that to ourselves.
Yeah. Yeah, I mean, like, my story is my mom got sick, she died, she had cancer. Like, your end of story. Like, all the little nuances aren't really important to the lawmaker, but, if they can at least remember it or put a face to the name or, like, I think there is some power in just having that sit down with the lawmaker, so and it's quite interesting, like, hearing them talk back too, like, why they feel they can or can't support, or they'll have questions, which are really cool. That means, okay, they're thinking about it or, like, they're interested in helping because literally, who can't say that cancer has not touched their lives, So it's really important to kinda keep that in the forefront, like, "Hey, we still need this is still going on. We still need to fight for this." Well, thank
Thank
you
you
for
so
having me on.
much, Dawn. You're such a great speaker.
Oh,
Yeah, that was awesome. You were really, even though whether it's true or not, lawmakers don't care about those little details. Patients do, caregivers do,
yeah.
healthcare providers do, neighbors, friends, right? That person who just got diagnosed, that person's who mom is about to have surgery tomorrow. Those little details actually make a huge difference. And then those people become advocates, and now they can speak on behalf of so many people as well as tell their own personal
Yes.
account.
Yeah, I mean, they say that in the advocacy, like, our last big, conference, they were like, "You guys are the voice for the voiceless," and, like, that's kind of just a really powerful like, yeah, I'm here representing all of these people struggling and going through it right now, so
Yeah, and your story humanizes healthcare and
yeah,
policy, which can often feel so void of
yeah,
emotion and humanity. So you thank you so much for sharing your mother's story, for being vulnerable enough to share your relationship with your dad, as distant as it may be. A lot of us go through that throughout our life, and we never talk about that. Even in sensitive times, you would think it would pull us together, but sometimes it pulls us apart. We thank you for sharing your background with advocacy and, of course, taking the time out to share your story with this platform, given you are very busy. So,
yeah.
everyone. Oh, you know what it is? I want to have you back in season 3 to talk about back pain from the physical
Oh,
therapy perspective because
yeah,
it's such a huge problem. And if we can help people avoid, they have to go through physical therapy before they can go to surgery. So if there's some things we can share with people, we would love to do that.
yeah.
So look forward to that, everyone. Season 3 is over this summer. So just to recap, everyone, remember you can always email us your questions or show ideas to tmi.melanin at Gmail. Subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook. Please share the show with your friends. Rate the Apple Podcast and Spotify. Leave a comment. It really supports the show and it helps get the message to those who need it. You can find our social media and any resources that we mentioned throughout the show, like Susan G. Komen, down in the description box. We release a new show every week on TMI Tuesdays at 10 a.m. On YouTube and all your favorite podcast apps. Follow, like, share our content, tell your friends. Thank you, Don. Thank you, Dr. Mucci. And
Thank you for
thank
having
you for
me.
watching. Can't
Have a
wait
good
to meet you
weekend.
in person. My mom's coming to Florida this week. To
Where?
Petersburg. I'm going to tell her yeah, you guys should meet up. Yeah, yeah.
Why is she coming down? Just to see the
Like,
beach?
yeah, since I went, now they want to go have vacation.
Yes, let me know. Let me
Yeah,
know.
they'll be there Wednesday.
Oh, okay, yeah. I'm gonna send her a message.
Okay, great. Thanks everyone for watching.
Thank you. Bye.